My name is Charles. 12 years ago, I was diagnosed with type 2 diabetes. It set me on a journey to better understand this condition. It's taken me around the world as I hope to change not only my life, but others living with this disease. I've teamed up with some of the best in health to find ways to not only control, but to reverse. It does not take much to live for others, and what we leave is how we will be remembered. I hope at the end of this journey, we will see that hope is a good thing and the start of a better future. Welcome to Reversed. It was hard to sleep last night, thinking of how today will play out, and anxious to get started. I can't wait to see how they embrace these changes.
This show, the first season, meant so much to me that I was able to be a voice for other people that are diabetic and actually have a voice for them as well as myself. I'm here to learn everything that I can about keto, because going into the grocery stores and trying to shop, you can see keto this, you can see keto that, but is it right for me? So for me, I have to really learn what keto is, the keto lifestyle, and I'm willing to do any and everything that's going to help me live a better, long-lasting life.
And so I'm really excited. The keto diet, I have already started it about a month or so, and I've seen substantial weight loss. My A1C is dropping, my regular sugars are dropping, my daily insulin intake has dropped tremendously. So I'm here to get it right and to reverse this diabetes problem.
I'm here to support my mother, Lisa, by encouraging her to stay on track with her eating patterns and to help her dive deeper into the ketogenic diet.
The main reason that I'm here is because diabetes, particularly type 2 diabetes, has been in my family for generations, and I am trying to break that cycle. I've been diagnosed about 7 years ago with type 2 diabetes, and I would like to learn so many things about how keto and intermittent fasting can help reverse the symptoms of diabetes.
Okay guys, during the planning with Charles, we were talking about a way to measure the point where you are right now, and then figure out how your bodies are going to change during this process. My name is Dr. Donald Vega. I'm a nutritionist, and I'm really passionate about teaching people that they can change their lives by changing their lifestyles, not necessarily only with nutrition, but a whole set of behaviors that we repeat every day, which at the end is what make or destruct our health. So we're gonna use this technology is in body, and it uses electrical currents that go through your body. So depending on the amount of water and lean tissue, it makes an interpretation, and it will give us body fat mass, muscle mass, water, and something that is very, very important because it is correlated with insulin resistance and type 2 diabetes, and that is liver fat. So Dr. Ken, what can we expect in this process?
So what we would expect to see, if this diet is actually a proper human diet, is we would expect to see the most dangerous kinds of fat, liver fat, pancreatic fat, decrease rather quickly okay? And ideally, we would put you guys in a big machine in a hospital setting called a DEXA scanner, if you've ever had your bone density checked. It can also check for visceral fat and for your body fat percentage, but we couldn't get it up the mountain. I'm so excited to interact with Lisa, Jerome, and Janet. I think that they are the wonderful examples of just the regular diabetic walking the street who have been told 1 million different confusing things, and I think the opportunity to have them here in Costa Rica for a week is just, it's glorious. So we're going to settle with this, but as you decrease your carbohydrate intake and as you increase your healthy fats and your healthy proteins, immediately your body's going to burn up and get rid of the most dangerous fat, which is fat in your liver and fat in your pancreas. Those are the fats that lead to the huge increases in bad outcomes like heart attack, stroke, heart failure, liver failure. So it's very powerful stuff, and it's really hard to know if you're on the right track unless you track and unless you check at the beginning of your journey. So then you can recheck later and go, yeah, look at that. It's going in the right direction.
Yeah. So I need you to be barefoot because we're gonna stand you up in that machine. And can we remove that boot for Lisa, please? Because we need you to be able to stand up in there. Can you do that?
I'm going to have to be very, very careful because I don't have an ankle joint, so it.
Okay.
But I'll be very, very careful.
Okay, we can help.
Okay.
Lisa has one of the many diabetic complications that you can have from long-term uncontrolled diabetes. She has something called Charcot, deformity of her right foot, and it's gotten to the point where she has to wear a special boot. She had several surgeons tell her she needed to have the foot removed, and Lisa's a bit stubborn, so she said, no, it's my foot, I'm going to keep it, thank you. And so she has to wear this special appliance in order to keep her foot and in order to have any degree of mobility. And I applaud her for wanting to keep her foot.
Yeah.
And hopefully we can keep that foot for the rest of your life. But she has to wear this thing. And so your right foot needs to be in contact, but obviously you're not going to put any weight on it, but it does need a touch. Yeah.
She'll be putting pressure on your side, mostly.
One quick note, we
Get
need
your feet
to
right.
wrap her from her clothes, not from the skin, because it's going to affect the results.
Okay.
Okay, great. You can put it back. There you go.
Yeah, I'm going.
Okay, go ahead. Extend a little lower. There you go. People will understand that with simple steps, there's a lot that can be achieved. And Reversed has a mission, and the mission is to start spreading the word one by one. And I believe, and that's my belief, that if we can get all together and push all this information, people's lives can change not only in English but in Spanish as well. And we're talking about potentially the whole world experiencing a different way of living just by changing little things. Okay guys, this is the first part. We're gonna measure this again on Sunday, the 6th day, and then we're gonna do it again once you have finished the program and see the great results that you're gonna achieve.
Thank you so much.
Thank you.
Coming up on Reversed.
Today I'm grilling burgers with everybody, and we like to call them meat cookies.
My vision is back since then.
Is it?
Yeah. I can see the mountains. I can see the water.
So I literally feel like a proud papa. I got you guys all here, and I literally brought in some of the best of the best. And for me, it's a privilege. And Dr. Ken Berry is literally one of the best of the best. I mean, this is like a guru of health. So for him to say, I'm gonna come here and take a week out of his time when he is a doctor that is practicing, is means so much to me, because to have a dream and have people like this support that dream. I truly thank you, Dr. Ken.
It's my pleasure.
You guys have a great session with Dr. Ken, and we have many more to come. All right?
All right.
Thank you.
Good.
Love it. All right, guys. How's it going this morning?
It's going pretty good.
Yeah, good. I know that we've thrown a lot at you guys. You must have some questions, and you must have some concerns, and you must have some things to talk about. So,
My doctor prescribed 1,000 milligrams of metformin, and my biggest fear is going on insulin.
yeah.
And it's not, I'm not afraid of needles, it's not that, it's just that I want to try and a different way, a natural way
Yes.
to defeat this if it's possible.
The reason that doctors ignore the diet and lifestyle thing is because, first of all, doctors are trained to prescribe medication. That's what they're trained to do, right? In our modern medical schools, all doctors minimize the diet and lifestyle changes because they don't think they're going to work. This keto way of eating is helping us all rediscover the proper human diet and the proper human lifestyle and how we should actually eat on a daily basis. With type 2 diabetes, that's another thing they notice is a few weeks or a few months into keto, when they stand up, they start getting lightheaded. And they're like, whoa, I don't know, what's wrong with me? Their blood pressure is returning to normal or close to normal. And it's time to stop some blood pressure medication. Now, you're reaching the point with keto, because you've been kind of dirty keto for a couple of months and now very clean keto since you've been here.
Yes.
And you're starting to get a little lightheaded when you
Yes.
stand up.
Yes.
And that's a very common sign that you're on too much blood pressure medication. So we're in the process of getting a blood pressure cuff in here, and we're going to start monitoring your blood pressure because I suspect it's time for you to throw one of the blood pressure pills in the garbage.
Do you truly believe that your symptoms can be reversed through diet?
100% do, because I did it myself, and then I tried it with my metabolically just destroyed patients who weighed 300, 400, even 500 pounds. I would be like, well, dude, I mean, do you mind eating beef, butter, bacon, and eggs for a month? And all of them were like, well, no, that sounds great. I've been eating the keto way for at least 8 years. And that's not to say that I haven't had a slip up here and there, but on the whole, I eat the ketogenic way. And I think that my friends and my family and my patients, they've seen the change in me. And I think that probably speaks much louder than my words, is them knowing the old me and how I used to look and how I used to feel. I think that's very powerful for friends and family and for patients to actually see you walk the walk and see you benefit.
So if you told me that and you were my doctor, I would think that you're joking.
Right.
And then,
You think I'm being sarcastic? Yeah.
yes, and then also the key component here is cut carbs and sugar.
Right.
I mean, in conjunction with adding protein.
Right.
Protein and fat. Yes. We've all been misled and we've all been mistaught, and that includes doctors and dietitians as well. And one of my biggest hopes out of this thing we're doing here is, number one, to help your guys' health. That's my number one goal. But number two goal is to hopefully shift the conversation away from plant-based vegan is the way, and you don't even get to have a conversation about any other option. That's not the proper human diet. To eat a plant-based vegan diet, that's not it. And only chronic disease and chronic inflammation and chronic vitamin and mineral deficiencies, that's what's going to come from that ultimately. Maybe not overnight, but ultimately that's what's going to happen. But that's the ultimate goal, is to eat. If the meat wasn't regeneratively ranched, I don't want to talk about it. If the plants were monocropped and destroyed the soil, I don't want to talk about it. Anytime in the future you hear somebody out there say that just a blanket statement, meat is bad for you, remember, what species am I? What have we eaten for the last 250,000 years? That's fake news. They're trying to mislead you.